tardes. Y me toca a mí hacer los honores de la tarde y agradezco una vez más a Antonio por la organización de este encuentro, que me parece una joya, la verdad, y sobre todo por poder desarrollarlo en esta sala en concreto. Y damos paso a las charlas de la tarde y empezamos con, bueno, hemos hecho este cambio con Dani y Luis, así que empezamos ahora directamente con la de Luis Ríos sobre los teenagers neandertal.
Well, thank you to my colleagues and the staff from the museum for the organization and for inviting me to participate. I'm going to talk first about the human life cycle and adolescence, and then I will try to present the research that this is ongoing here with the Neandertals from El Cidrón and doing some comparison with extant humans. But first, an inquiry into the stages of the human life cycle engages us with ancient traditions of thought. And one of the most well-known examples would be the riddle posed by the Sphinx to Oedipus. What has one voice but goes on 4 legs in the morning, 2 legs in the afternoon, and 3 legs in the evening? And Oedipus answered correctly, human beings. Because we as babies crawl on all 4. As adults, we stride on 2 legs, and in the old age, we might look for support in a walking stick. And this is the topic of the stages of the life cycle, or the ages of men, as represented throughout history. And it's a topic that at the beginning of the Middle Ages already was theorized. And in one of the first encyclopedias, San Isidoro de Sevilla, in his etymologies, described 5 stages of the human life cycle: infancy, childhood, adolescence, youth, maturity, senectitude. And as Alison Goldnick, a professor of psychology, reflected a few years ago, this riddle illuminates the question, what does it mean to be human? Because the many ages of our life cycle are a crucial part of what makes us human. From a biocultural perspective, we could define extant human populations as individuals in different stages of the life cycle with different social and metabolic demands, interwoven in a social group that reproduces over time. So there's a deeper meaning in this riddle. And to put it more from an evolutionary point of view, John Tyler Bonner, in his 1993 book, Life Cycles, wrote that the great lesson that comes from thinking of organisms as life cycles is that it is a life cycle, not just the adult, that evolves, which is an interesting message and a fruitful perspective to approach any topic in biological anthropology. But how many life stages in Homo sapiens? Well, I will focus on the growth in height because the current accepted model relies on this graph. And we have in the horizontal axis age, and on the axis on the right we have height, centimeters, and this is the velocity curve from birth for females and males. And on the left, we have height velocity, centimeters per year, per age. And this is the acceleration curve. So if we focus on the acceleration curve, we might see first, the first stage would be infancy. It's high velocity, but deceleration is totally dependent, is breastfeeding. Then we have childhood, which is post-weaning and alloparental care, and is plummeting the growth in height and weight. Then we have the juvenile stage, and that would be, from traditional societies, the apprentice. Is changing some important neuroendocrine changes, but is preparing for adolescence. Adolescence that is defined by this acceleration is the growth spurt in both sexes. And then deceleration, and then we reach the adulthood. This is the model proposed by Barry Boggin and Holly Smith in his 1996 article, Evolution of the Human Life Cycle, that has been briefly and recently reviewed, Evolution of the Human Life Cycle Revisited. And this is what this says. We emphasized that the total combination of stages, periods, is a defining characteristic of Homo sapiens. Is this life cycle unique? That's the perspective of Boggin and Holly Smith. But everything is nuanced. So In comparative perspective, we are going to compare it with our closest living relatives, panins, mainly chimpanzees, but also bonobos. And this is our growth curve. And this is the growth curve until now. This is not height, but body length, the length of the body of the chimpanzees. These, of course, are all longitudinal samples, very important. And they have infancy. Let's focus on the velocity curve. High velocity, deceleration, juvenile, and then adulthood. And there is a lack of the growth spurt. So the two stages that are unique to humans would be childhood and adolescence in this model of Boggin and Smith. So let's focus on adolescence. Well, let's go to how adolescence is defined by medical doctors specialized in adolescent research, in this highly cited paper, The Age of Adolescence. And adolescence is a stage with elements of biological growth and major social role transitions. Biological, we are going to talk about just three: onset of puberty, which is hormonal reactivation, growth spurt, acceleration, and secondary sexual characters and sexual maturity. From the social point of view, there is a period and stage of intense social learning and interaction for acquiring skills and social relations that are crucial for survival and reproduction. And adolescence transition us to adults, which traditionally has been evaluated with these hallmarks: completion of education, employment, marriage, and parenting. But these biological and social factors changes, and that's why these medical doctors propose to change the current definition of adolescence from 10 to 19 years old by United Nations and the World Health Organization to this one, until 25 years old, because these hallmarks of adulthood are reached later and later worldwide. It's a trend worldwide, and especially in Western societies. Okay? So the message here would be that it is a very complex stage of interrelated biological and social changes. If we talk about adolescence, this would be the biological ones that we are going to focus on. So we better, I would say, lower expectations when talking from fossils into this complex stage. But this would be adolescence, as defined by medical doctors. And now, in comparative perspective, in Homo sapiens, puberty, but puberty is reactivation of the hypothalamic pituitary gonadal axis and happens in a lot of social mammals. And it has interactions with the environment through energy inputs and psychosocial factors that under intense study in extant adolescents. But we just, the message is reactivation of hormones. The growth spurt, the important point here, and for instance, Boggin emphasizes this, is that this is a growth spurt of all skeletal tissue. This is data, longitudinal data from the Harpenden growth study by Tim Cole, and here we see height, but also leg length, sitting height, shoulder width, foot length, hip width, every skeletal dimension underwent a growth spurt. Okay? Then it occurred in both sexes, and another defining feature could be its late occurrence. Then we have the development of secondary sexual characters, and here is, we are going to see this later, is a pubertal diagram. This is the acceleration, peak height velocity, deceleration, peak height velocity here, and these are years before reaching peak height velocity and years after reaching peak height velocity for girls. So on this curve, we see the development of breast, pubic hair, pulses of estradiol, reaching peak height velocity, further development of breast and pubic hair, and then menarche here in the deceleration phase, and then adult ovulation frequency, almost reaching adulthood, like 4 or 5 years after peak height velocity. And for boys, the same pubertal diagram, growth spurt, and then the peak height velocity, and we have here the luteinizing hormone, development of testes and penis, the first detection of sperm in urine, peak height velocity, further development of these secondary sexual features, muscle spurt in boys, and then adulthood. So we see here, we are not going into detail with the social interactions, but of course this is sociosexual signals developing here. Okay. And what's going on in Humans? In Humans, these are semi-longitudinal data, more half transversal measurements, cross-sectional measurements, and then some of them semi-longitudinal from Steve Lee. And this is the distance curve, and this is the velocity, pseudo-velocity curve in weight. We see here a growth spurt. So growth spurts exist in primates and can be detected in chimpanzee males. And these authors, following a large sample of bonobos held in captivity, and they measured forearm length, they detect a clear spurt in both sexes in forearm length. Okay, it's a recent paper. And they say that, well, the trick they say is that the scale, because they scale linear measurements to weight, okay? But they say that it can be detectable, growth spurts. And we see growth spurts, of course, in some other close primates, like in gorillas, like the body mass growth spurt, and a very small spurt in body length. But with this new mathematical approach, it might be feasible to detect like larger growth spurts. So as already in 1982, Watson Gavan was saying that the adolescence length growth spurt in primates would not be an all or nothing thing, but rather a matter of degree that we can see in some primates, in some skeletal measures. But remember that the emphasis growth spurt in humans is that it happens in all skeletal tissue, not only, for instance, in forearm length. And also, primatologists, they talk about adolescent chimpanzees. They talk, there's no trouble. There are chimpanzees in adolescence. In this recent article, they talk about the adolescent stage, puberty onset, adult behavior onset, and there are details about these hormonal pulses and these sociosexual interactions and development of secondary sexual features like the swelling of the female organs during adolescence and the enlargement and descent of testes in males, and a lot of changes in males that they usually stay in the group, females disperse, and there is a lot of changes during this period. So primatologists, they talk about adolescence in Humans. So this model is maybe needs to be considered with nuances, but as any model, because we cannot fall from the model of reality to the reality of the model. It's very useful, but there's more research and maybe more nuance, because in chimpanzees there is puberty, because it happens in social mammals, reactivation of the hormonal axis. Some growth spurts have been detected, and there is, of course, a period, it is, of course, a period of learning and social interaction. Okay, with this background, let's take a look to Neandertals, and this is the scheme that is accepted currently, the Bogan-Smith scheme. Childhood, adolescence is unique to humans. We have here Humans. No adolescence, but this is nuance, as we have said. What happened in this tweak of the tree of life is, I'm not going into details, but Australopithecus, habilis, erectus, and the appearance of childhood. There is a lot of recent papers in these hominins. But if we focus on Neanderthals, up to the juvenile stage, we did this research here, the Paleoanthropology group, with this Neanderthal skeleton, juvenile Neanderthal from El Cidrón. And what we are trying to replicate with the adolescents from El Cidrón that we are going to see now is first to have independent estimation of age that we obtain here through chronobiology of dental tissues. And then estimate dental age, bone age, and somatic maturation, and compare. At 7.7 years of age, his dental, bone, and somatic age is comparable to extant human children from the same age. So that was our comparison, and our answer was yes. So we think that up to the juvenile stage, Neanderthals are humans. In their maturation rhythms captured by these measures of dental, bone, and somatic maturation, you cannot distinguish clearly ontogenetic differences between Neanderthals and humans with these variables. And what's going on with adolescence? Well, first, what happens to the bones in adolescence? Well, there's a lot of research by orthopedic surgeons here. For instance, this is the elbow, a radiograph, lateral radiograph of the elbow. And this is the ulna, humerus, ulna, and this is the epiphysis of the olecranon. Unfused, beginning of fusion, active fusion, completion of fusion, and we have here the age of girls and boys, because there is a sexual difference in adolescence. Girls go earlier and faster. And in a large sample of known age and sex adolescents, followed longitudinally, so we detect the growth spurt. Samples that came from healthy middle class or clinically selected by scoliosis mainly, but otherwise healthy. We can put a pubertal diagram. We have the growth spurt, and then this sequence of the epiphysis of the olecranon aligns like this. The fusion occurs during the acceleration phase of the growth spurt. But this is a consistent correlation in these extant humans between bone maturation and the growth spurt that we are detecting in these humans, in these samples, okay? But we see that there is some association between growth spurt and the sequence of fusion that has been studied. For instance, this is the thumb ossification composite index with several epiphyses, development of the sesamoid bone, and this has been staged in different phases, and this has been aligned to the growth spurt in another sample from which children that they have all this data. And of course, there is a consistent, correlation in these samples of humans between bone maturation and the growth spurt, because orthopedic surgeons use a radiograph to locate in which part of the growth spurt the patient is. Okay, they see the X-ray, it's in this phase, so it might be reaching peak height velocity. Okay, that's the rationale behind this analysis. And there are bone analysis for almost all joints of the skeleton. For instance, the calcaneal epiphysis, the phalanxes of the foot, the knee, all possible joints, because this is very useful for clinical purposes. So what happens to the bones? The epiphyses start to fuse in the long bones, and there is a correlation between growth spurt, bone, and dental maturation in some extant human samples. Okay. So, with this background, we are going to take a look at the Neandertals from El Sidrón. And what we are going to see now are the bones from El Sidrón that, due to its size, shape, and maturation, we would refer to as adolescents by extant human references. Okay? So we have a thoracic block, which has epiphyses of the transverse apophysis of the vertebra, the thoracic ring epiphysis. So we have unfused active fusion. There are several epiphyses of the thoracic region. We have the clavicular epiphysis, the medial and the lateral, in this case unfused, but the size of the clavicle indicates us that is of adult size, and the clavicle is the last bone of the skeleton, one of the last bone of the skeletons to fuse. We have a humeral head epiphysis with active fusion, distal humerus with the medial epicondyle unfused, but the distal epiphysis already fused. We have the epiphysis of the ulna that we have already seen in active fusion. The epiphysis of the elbow are the first to fuse in most humans. And we have a radial distal epiphysis, again with adult size and shape. This can be evaluated through bone maturation, but unfused. We have metacarpals and metacarpal heads and proximal phalanxes, unfused and inactive fusion. A femoral head, unfused. Distal femoral epiphysis, unfused. Fibular distal epiphysis, the diaphysis and the epiphysis, unfused, but the size is almost like an adult. The hallux proximal epiphysis, an hallux with a fusing epiphysis, and the first hallucal phalanx with also with active fusion of the epiphysis. Other metatarsals, and also sphenooccipital synchondrosis without fusion, and we have 3 third molars in different stages of development here, that they belong to 3 different individuals. So this would be, there are few more. Well, there's a lot more, but these are the more representative of the specific elements of the skeleton. So these are what we call the adolescence of the Sidron. The null hypothesis, which would be a good null hypothesis from what we have just seen, the debate about the uniqueness of the human life cycle, the studies on Hominins. Well, the hypothesis would be that teenagers is a term to define boys and girls between 13 and 20 years of age. But our null hypothesis is that there were teenagers, pubers, and adolescents Neanderthals, because they are so close to us. And we have seen that until up to the juvenile stage, the growth pattern is very similar. So the null hypothesis would be this, that there is no difference. How are we going to test this? The scheme would be the same. Well, first, we first should try to reassociate bones and bones with these teeth. And one possibility is chemical fingerprinting. If not, through a statistical modeling, it could be done. Then sex assignment, because there are sexual differences in adolescents, and sex is an important variable to put in this model. So through dental measurements or through enamel peptide analysis, there are some possibilities. So we would like first to obtain the chronological age through chronobiology of dental tissues, then estimate dental age, bone age, and somatic maturation through all these different methods of bone maturation that are currently used in clinical practice and research, and make a comparison to see if at date age, the dental bone and somatic age of these Neanderthals is comparable to extant human adolescents from the same age. That would be the test of this lack of differences between. But we are in this is what we are doing now. Just to show you a short example, we don't have the chronobiological ages, but to see some comparison between dental age and bone age, these are the 3 third molars from El Sidron. This would be a quick dental maturation from the Morris and the Mugen stages. And this is the active fusion of the olecranon epiphysis of one of the bones from El Sidron. So let's play with these third molars and this olecranon. How do we do this with archaeological skeletons? This is a skeleton from Sudanese Nubia, 300 years before Current Era. It's a female skeleton because it has been diagnosed through proteomic determination of sex, and it has some signs of disease that could be malaria. But we see the molars in development, and that would be the assessment of dental age. And in archaeology, what we do is to estimate the chronological age from dental age. That's what we don't want to do with Neanderthals. We need dental age to compare to some measure of chronological age. But here, the age would be 17, 18 years of age. And this is the stage of fusion of the epiphysis of the elbow. The distal humerus is fused, the lateral epicondyle is in active fusion, proximal radius is unfused, the epiphysis of the olecranon is in active fusion, and we have seen this epiphysis. This is the age of this skeleton, this Nubian skeleton, and the developmental stage would be this one. So, in this sample of living adolescents, this occurs at 12.5 years in girls and 14.5 years in boys, okay? But what we are seeing here is the same stage of development, but if we take dental age as chronological age, it's happening here. So what we see is that there is a delayed adolescence, and there is a lot of research in archaeological samples with this method, okay? Saying, is adolescence delay in the past? For instance, in this sample of ancient Nubians, well, it looks like it is by a few years, okay? And this, remember, that in the deceleration phase is where menarche occurs. So this menarche would be delay in comparison with this sample of living children from clinical studies. So this would be like this stage of development of third molar and this the bone age. So this would fit here or here in this comparison, but we need chronological age. This is just to show you an example and to start to see some bones, some Neanderthal bones in these pubertal diagrams. The trouble is that to place Neanderthals, we need to quantify human variation and what kind of samples include for comparison, because there is a huge variation introduced by different living conditions in humans. So we can see delay adolescence in this archaeological sample, and we can see this correlation in these, I would say, healthy living children. So there is a huge extent of variation in Homo sapiens, and we need to quantify that statistically, and we have gone to documented skeletal collections in Lisbon, in Bologna, and take all this data, and we are going to approach this from a statistical point of view. Another point would be if El Sidron Neanderthal is a healthy sample, because we are in this debate, which is the best sample to compare with Neanderthals within modern human variation. And then we need also chronological age and reassociation of sex, but this is how we are, the research of our group is on these Neanderthal bones. So I would say that the new hypothesis is that we can talk of Neanderthal teenagers. They were pubers. They probably experienced growth spurt, but this is an opinion, because I have not go deep in growth spurt, because growth spurt is, by definition, you need longitudinal samples to detect, or a very, very large samples. A very large sample of different ages is complicated, but based on comparison with our closest living relatives, I would say growth spurt is probably, and they experience adolescence. So in a very particular way, of course, because we all know that Neanderthals demographically were very particular, but this is where our research on adolescence stands now.
Okay, so good. So, any questions?
Oh, perdón.
Thank you, Luis. So I read that there is a considerable number of Neanderthals with hypoplasia on the third molars. There's a study comparing them with the Inuit population. They suggest that this could be related to the growth spurt and the beginning of the adolescence because of the timing of the production of the... What do you think?
But related, you mean, for instance, energetically? It's costly, the growth spurt, and then it absorbs so many energy that it creates a delay in the ameloblast. Yes. That's the question.
Yes.
I don't know, but that's the honest answer. But, well, I would like to see the hypoplasias of those Neanderthals, because I have studied archaeological samples, and then you see huge enamel hypoplasias, like very intense, repeated episodes. And I think that some of these human samples experienced adolescence. So I don't know. But it's an interesting question, because it relates, can we consider the Neanderthals from El Sidron as a healthy sample? And then what is, and if not, if it is or if it is not, which is the best comparative sample? If we assume that those enamel hypoplasias are related to the growth spurt, then we should focus on archaeological skeletons with delay maturation. The trouble is that we wouldn't have chronological age. So we might have found an intermediate solution, because in historical, documented historical collections, like the Lisbon collection, the Bologna collection, because we have seen them with Antonio, and it's published, they came from not, I would say, chronic, moderate malnutrition. So it would be a good comparison for Neanderthals. I would say maybe the clinical samples wouldn't be a good comparison. The historical collections from cemeteries, known sex and age, I think is the intermediate solution. Because if not, you go to archaeological samples. But for instance, this sample that we are studying now from Southwest Nubia, which is a place with endemic of malaria, and we are seeing a lot of delay in bone maturation. I think that is not, it would be an extreme of variation, I think. But yeah, I don't know if I have answered, but the best solution, I think that your question refers to, or would be interpreted, what is the best comparative sample?
Yeah, okay.
So historical skeletal collections, I would say.
Thank you, Luis. Please, could you explain us a little bit more, or just repeat it, whether the Panin's has adolescent period, puberty, growth spurt? Because as far as the more I learn about this, the more confused I get. So I'm not sure whether these animals has this growth phenomenon or not, or if we can consider what we are talking about a discrete feature, or is just a continuous?
Yes, I think that we are captives of words, and we talk about adolescence, and we have seen that medical doctors now studying living samples with a lot of information, clinical histories, longitudinal follow-up, radiographs. It's difficult to define adolescence, and it's a very complicated stage of interrelated social and biological factors. So it's to see this, which is the model that I use, and I think it has moved research forward a lot. I really think so, and Barry has been here with us. But this model is just to clarify, this one. This model is Boggin and Smith model is very useful, but it has to be nuanced by recent research. So it's not going to move, I think, this is not going to change for humans. No. But for Panin's, there is more and more research, and until recently there were not longitudinal samples, because Lee collected semi-longitudinal samples and cross-sectional samples from American zoos, I think. And this research they did on a large colony of bonobos, so followed longitudinally. And they say they detect growth spurt. The trick here is that they say that you have to scale the linear dimensions, because you see that it's centimeters 2.5. Because they say that you have to scale. There are different dimensions, the mass and linear, and then if you scale to you put the weight into the equation, you detect the growth spurt very clearly. They detected this without this scaling, but they detected some growth spurt. And already this is what...
Only in bonobos or also in chimps?
No, in chimps, as far as I know, only in bonobos, in this study.
It could be a bonobo stuff.
It could be a bonobo stuff, because, for instance, when you talk to Barry Boggin, he says, first, in humans is growth spurt of all skeletal tissue, not just the forearm. It could be forearm, or of course, there are some growth spurts from male chimps here, but it could be just bonobos. It could be bonobos and chimpanzees in forearm and some other measurement. Because, for instance, Hamada didn't detect in this curve, Hamada didn't detect the growth spurt. This one is from longitudinal data from Hamada, from Japan. But these people from Netherlands, they say that they should reanalyze this data, scaling data to 2.5, and then they might detect the spurt. So it's, as they were saying 40 years ago, Gavin and it's not an all or nothing. It might be like, so to speak, a module that is there, and then It's in some, and then other primatologists talk about adolescent chimpanzees. They have it very clear and it's very detailed. Of course, it's very different to what we understand as adolescents in our life and in human societies now. So different. But it's a matter of degree, and that's what I think evolution, it shouldn't surprise us to see that Neanderthals are very close, because we see this research in Humans and these nuances, and we are going Neanderthals so much closer to extant humans. So it's better to see that they are just models, and we are testing the models with new data and new approaches.
And you put all the extinct humans in between chimpanzee and modern humans. There's the possibility that it's not an intermediate stuff. I mean, could Neanderthals have evolved their own proper patterns of development? I mean, not humans, not chimpanzee, something different. I mean, why to put all independent lineage
of course.
in an intermediate stage?
This is a simplification, and it's like this linearity of this scale, no? But this is each of one develop specific solutions to growth. So this is just a simplification. Just to put that, this is what is accepted now is this, that childhood appears somehow at the beginning of genus Homo, and then it's enlarged, and then it's, but it could be like the thing is that we also interbred with Neanderthals, so everything to me supports the null hypothesis that we were very similar in everything, in the basic. We are not going like I mean, this is not deeper meaning in the sense of explaining Neanderthals. It just captures like patterns of growth, large patterns of growth and maturation. And I think in that we are going to be like very similar.
Okay, if there are no more urgent questions, I think it's the turn of Almudena. So welcome.
Mm-hmm. So, good afternoon. Thank you for still standing here. And yeah, I am Almudena Stalrich. I am a Ramon y Cajal Fellow here at the Museum. And my research and the things I'm going to present are quite a bit different from the previous one. I study dental wear, and mostly I study behavior. That is something that doesn't fossilize. So how do we study the behavior of the fossil hominins? The first thing we need to know is that dental wear is a normal thing. The teeth need to be worn down. So when you see a worn teeth, it's a healthy and regular person. When you see otherwise, is when you have to look at it. So there are two types, what I consider two types of dental wear. One is this one. Nope. Okay. One is the one that you can see, you can consider not related to diet, and the other one is the dental wear that is related to diet. So teeth I usually use it to broke the food and ingest, and for diet, it's everything in all the animals with teeth. And sometimes the humans, we do something with the teeth that is not, as I said, related to diet. It's oriented to prepare the food or use whatever other thing, like biting our nails or whatever. I'm sorry, I'm a little bit, today it's not my best day. So I'm going to start with the paramasticatory dental wear, that it's, previously Emiliano mentioned it. And there are some few examples of paramasticatory dental wear or activity-related dental wear. The first one is the tooth-picking grooves. Is when traditional, we use toothpick to clean between the teeth. Usually the wooden stick doesn't leave any mark, but if you use some grass stock, you can have these marks. You develop a groove, and inside there is a lot of microstriation that is characteristic of this feature. Another feature is the chipped enamel that is broken, like a missing flake of enamel. You can see the missing flake. And another type of dental wear is this cultural or instrumental striations that happens on the labial surface of the teeth, mostly on the anterior dentition. Traditionally, these marks have been used to record the manual laterality of the individuals. The chipped enamel have been used for the division of labor, same as the cultural striations, and these tooth-picking grooves are related to the dental care. Oh. So I've been recording these marks during the whole Pleistocene and recent times. And I've seen that the cultural striations, dental chipped enamel, and tooth-picking grooves are mostly universal across all the human evolution since the early Pleistocene. But in the later times, Polish enamel and incisal grooves that are the same now, the tooth-picking, but in the incisal surface of the teeth are present. And one thing that I wonder is one of the problems or the problems to solve that I found was okay, it's nice to have a lot of Neandertals. We have a lot of anatomical modern humans, mostly in recent times, but we have few samples from the early Pleistocene and middle Pleistocene. So I was thinking maybe this situation, these changes in the features are due to the sample size, or are they intrinsic of the behavior of these fossil hominin? So for that, I took, this is just for you to have an idea of the samples that are responsible for that number in the early Pleistocene. It's a case of interproximal grooving in one Olduvai hominin. We also record another one. This is another example. All of them, the three of them, 1.8 million years ago. So in the middle of the early Pleistocene. And here is the only case recorded of these cultural or instrumental striations, also in Olduvai Gorge. All these specimens belong to early Homo, or in some cases, Homo habilis. And yeah, those are the few cases recorded until now. In the Paleoanthropology group, we have decided to increase the sample. And for that, we are now studying with collaboration with the Olduvai Gorge Archaeological Project. We are studying a new specimen of early Homo, and we have added Paranthropus boisei here to the sample. And something curious, we found cultural or instrumental instruction. So, and here is marks of toothpicking in this Olduvai hominin. So not just we have increased the, the number of specimens with this type of modifications related to the behavior, but we have added this specimen from another genus that is not Homo, that also has these traces of behavior that, of course, we need to explore in a little bit more, because, yeah, those are preliminary results. This is the first time I show this picture. And, yes, they are clear cut marks, but this is not what I was expecting. So it's nice. We have also added this specimen for Tigenif 1 million years after that, and we are starting to study the paramasticatory dental wear. So, yeah, the Earlian Pleistocene needs to be increased the sample. The next one is to increase the sample during the Middle Pleistocene, that it was also really scarce, the evidence, and maybe they were due to the small sample size. It was mostly the cima de los huesos sample. So here is the Ridera Villares dentition that Danny presented the project. So nothing new to add, but yeah, this is a nice specimen in the teeth, and we are looking in the molars to look at the interproximal grooving, the toothpick grooving, and we are waiting for the incisors and canines also to show some, we expect they have some traces. We also wanted to increase the samples in the Middle Pleistocene because mostly the Neandertals were the ones from El Cidrón, Ortus and Spee in Belgium, but we have increased with the Simanya cave in Catalonia and the Mariela cave. And as you can see, they have all these striations. Here are some striations, some chipped enamel, and some more striations. So they have all the traces we expected them to have. So nothing strange here, but we need to increase the sample to make sure that these changes that we plotted in the beginning were real or not. We are also increasing the sample size from the late Pleistocene, from the Magdalenian period in this case, archaeological context, and this is the red lady from El Mirón in Cantabria, and this lady has a lot of this microstriation, and they are due to speaking. And yeah, there are also the cultural striation and the chip denament. So nothing different also from Neandertals in this anatomical modern human. And another thing that it was important to note in this graph is the absence of the cultural striations that have been present during the whole Pleistocene. It was completely obliterated from the record after the Neolithic Revolution. And there are several hypotheses regarding that. Is that the reduction in the lithic morphology also has an important play in the game. When you have like a Mousterian flake, it's easy to to hold something and cut it. But if you have microliths like this one big, it's impossible to hold and cut because you are going to swallow the lithic. Otherwise, if they are really small, it's really small to pick in between two fingers. And sorry, we are exploring with a new sample from the northern part of Spain because the record is good in this region. There are a lot of gravestone, graves and with a lot of shell middens with skeletal remains, more or less well preserved. And those are the cultural periods that we are going to study. And yeah, that's for the adults. But what happened with the children in the group? If we are going to study behavior, the adults, they didn't live alone. They have some immature individuals around. So we try some Neandertals. We study these ones from El Castillo Cave in Cantabria, and these ones from Krapina in Croatia. And we saw the same features, the cultural striations here, some cultural striations, some dietary striations. But yeah, it was possible to recover the same features recorded on the permanent dentition of the adult individuals. We found similar on the deciduous dentition, the tooth picking, the cultural striations that allow us to have some peaks, some insights into their manual laterality. And in conclusion, we said that they have a similar paramasticatory dental wear as the adult individuals within their groups. This gives us clues about the childhood development when they begin to be more independent, about the learning processes, the support they receive from the group, and mostly the behavioral dynamics within the group. We propose that all the individuals were taking care of themselves and were contributing the same way to the well-being of the group. And we are also increasing the sample because it's really small, the zero sample. So we are working with the responsibles from the Riparo Tagliente. I don't know if I'm pronouncing it well, but Riparo Tagliente in Italy. And yeah, we are studying the two deciduous teeth they have, an incisor and a molar. And we are going to study both the paramasticatory and the masticatory or dietary dental wear. So the next one, dental wear related to diet. There are different approaches. This is the first one. This is the dental microwear texture analysis. The idea is to study, this is an optical profiler, confocal profiler here at the Museum, the Servicio de Técnicas No Destructivas del Museo. This, we have to study high-resolution epoxy replicas of the teeth, and we place it, and we study the surface here in high magnification, 1000 magnification, and we record the surface in with different variables, measuring the scale of complexity depending on a scale. The fractal analysis of these variables to analyze, and yeah. We found previously some good results, in my opinion. It's that with the sample of El Cidrón of 11 individuals, where actually there are 10, because the juvenile was not included in this one, 10 individuals with teeth were added to the sample of the all Neandertals. From good environment, the previous number was only 4, and we added 10 more, so 14 Neandertals. What we achieved was to increase the range of the dietary reconstruction for Neanderthals from water environments. It was more diverse than previously thought. They thought that it was a small range in complexity. That means that they eat the same types of food, all the people, but yeah, and there was mostly vegetables, but we increased this, so it's important. The next one, oh, okay. Another result we obtained with our sample of 10 individuals from El Cidrón was that the females had a diet that was a little bit more abrasive than the males from the sample. And we were not able to do a statistical analysis because the sample was really, really small for that. But we proposed that that could be related to some kind of the division of labor that we previously saw in the sample. So, yeah. For that, we want to enhance the sample, and right now we are working with the same Italian and French Neanderthals to compare with the base that we have previously. And also we are including the Middle Pleistocene sample from Tigenif and Ruidera Villares, because no dental microwear has been done on Middle Pleistocene. So we need to increase and develop the new database to say how was the real relationship between these individuals and the environment they live in. We are also doing that with the Upper Paleolithic people. And in the case, for example, the red lady from El Mirón, it's a Magdalenian woman that was buried in a red ochre, so that's because it's a red lady. And comparing with all the individuals from the Magdalenian, she lives like a complete different diet. And the subsistence patterns in these individuals, in these modern humans, it's conditioned with the preparation of the food. The diet is more abrasive because they introduce the preparation of the food outside the mouth, just to say, and they use abrasive tools to prepare the plates. They were introducing, I don't know how to say, but grinding stones and these kind of things, and the grit were introduced with the food to the mouth, so that's what caused the abrasiveness here. This means that this Magdalenian individual didn't use this methodology of preparation. So, and it was quite similar to the Gravetian individuals, that they were close in time, and more similar, the signatures of dental microwear are similar to Neandertals than to the Gravetian individuals. So there's something strange in this individual, and yeah, we are trying to decipher the behavior of this woman. And the other methodology that we are currently developing is the dental topography. It's also with molds, replicas, or sometimes the original. We use an intraoral scanner developed for dentists and by dentists. So it's nice to we need to trick the scanner to scan the fossil teeth, because sometimes they don't recognize, the software doesn't recognize the teeth as human. So it's kind of funny. And it's basically analyzing the surface, the topography of the surface. And we are testing this methodology with this thick-tailed galago. And we are presenting the results in a couple of weeks in the ABA meetings in Denver again. And the conclusion is that this method in this sample was really useful to distinguish between males and females in the wild. So the topography was able to separate the individuals in this regard. And there were inferences about how females and males use different the resources of the environment. Again, with the dental topography analysis and the occlusal fingerprint analysis, that we were able to study the biomechanics of the mastication. We are going to do a whole macroware, dietary macroware reconstruction for the L0 Neandertals. How the idea is to try to complete the previous results we found on dental microware, to use these two approaches just in case we can say something about the differences, if they are differences in diet between males and females. And another project that we are going to do is to study the dentition of the Krapina Neandertals. We have the molds already. And yeah, in this case, we want to study the changes in mastication and diet during all the age, not the biological sex of the individuals, but changes with the age of the individuals. Maybe it's useful at some point for distinguish between adolescents and juveniles. And yeah, some final remarks. It's what lies beneath the dental wear is the record of individual way of life. The behavior of each individual, the behavior within the group, and some processes like learning, dietary reconstruction, and how they manage the resources they live in. And yeah, tracing these patterns is what allows us to reconstruct the biocultural evolution of this. And yeah.
Okay, so good. Any question?
Thanks, Almudena. I saw in one of those slides a term that was called something like the theory of the Last Supper.
Yes.
What's that?
It's dental microwear has the ability to record just the 2-3 weeks previous to the death of the individual. So it's like the last supper. Because each time you eat and you chew, you are obliterating the dental wear. Yes. So something you eat, in 2 weeks, there's no trace on your dental microwear about it. So it's the last supper. Instead, the dental topography and this OFA methodology record the summary of your life. So, welcome.
Good, so if no more question, now I guess it's Carlos. Welcome.
No. Now? No? Yes? Okay. Thank you, Antonio, for organizing this colloquium and for inviting me. I'm going to divide my talk into 2 different topics that have been the main focus of my research career. The first one is the cervical anatomy that I studied here at the museum under the supervision of Marcus Bastir. And the second one is the study of the postcranial remains we have found at the Ruidera site in the work of the primeros pobladores del Alto Guadiana, whose PI is Daniel García Martínez, that talked previously about this project. Let's start with the cervical anatomy. That, for sure, you all know that is an important region of the skeleton, as it supports the head, protects the upper spinal cord, and is involved in upper limbs and head kinematics, and also in the thorax kinematics during breathing. And also is important as it relates with all the spine morphology, the spinopelvic alignment, and also the head and body posture. And classically, it has been seen as less lordotic, less curved in Neanderthals than in modern humans. However, this hypothesis was drawn based on a few metric measurements and in a few unfragmented fossils or specimens. So we wanted to apply more advanced techniques such as 3D geometric morphometrics, and we tried to add more sample to previous works. So we analyzed or a great sample of the most known Neanderthals in the fossil record, and we applied 3D geometric morphometrics to atlas axis and the subaxial cervical vertebra in La Ferracy, La Chapelle, Guevara, Sanida, Regordu, and a few Krapina individuals. Curiously, we found that the main difference in the neck between Neanderthals and modern humans were a huge difference at the level of C5 that was much more similar to C6 and C7 in Neanderthals, while in modern humans it still has a morphology more similar to C3 and C4, as we can see also here in these graphs. But the most important part of this work was to articulate each mean neck of both species to assess how it would have been. And we can see that both anteroposterior and mediolateral widths are greater in Neanderthals, while the length is shorter in Neanderthals, and we could conclude that at least the curvature would have been more or less similar or even greater in Neanderthals. That is contrary to previously hypothesized. Also, for sure, this different orientation and position of the transverse processes is important because it's the attachment site of, for example, the anterior and middle scalenus that are involved in breathing. So analyzing how this neck morphology could affect breathing is a next step. So because analyze how this neck shape could affect this range of motion, this motion in the first rib, and this is a next step once we have this mean neck of both Neanderthals and modern humans. We want to obtain in a future acute video like this, a musculoskeletal modeling of a Neanderthal during breathing to see the lever arms and strength of the muscles attached here. But at the first step, to start applying these new methods to the cervical spine, we made a brief study on the upper cervical spine. That is also important, and it's considered a separate anatomical unit because both functionally, anatomically, and developmentally it is so differentiated. The upper cervical spine is the occipital or the cranial base, the atlas and axis, and two main movements occur here: rotation between atlas and axis, and flexion extension in the three bones. We knew, because of previous works, that in both atlas and axis, and of course in the occipital, there are differences between modern humans and Neanderthals. And for example, in a work that we published 6 years ago, we noticed that the superior articular facet of the atlas was a bit different between these species. And we hypothesized in this work that maybe this morphological difference could say something about the mobility of the upper cervical spine. So luckily, we had data of ranges of motion of some cadavers, and we also had the 3D models of the upper cervical spine. So we tested these ranges of motion of the upper cervical spine with some shape variables, and we found a positive of the motions, some of the morphological characters. For example, we found this positive relation where when the superior articular facet of the atlas is flatter, the ranges of motion are greater. So once we have this positive relation, this is a 2-block PLS, we could predict, based on the morphology of the Neanderthals, we could predict the ranges of motion of those Neanderthals, and we obtained that the ranges of motion of both Neanderthals and modern humans would be more or less similar. That it's also contrary to previously hypothesized by Bean and Gomez-Olivencia in previous works that hypothesized that the Neanderthal neck would have been more stable than ours. But we wanted to go one step forward because it's not interesting only the range of motion, but the way we acquire this range of motion. That is the now? Yeah? We wanted to apply this procrustes motion analysis that maybe it's a bit tough for these hours, but I will try to make it as easy as possible. But it is somehow resumed to the fact that any motion can be represented as an ordered sequence of postures exhibited during a motion. That is, this motion can be represented as this posture, and this posture. So we are experts analyzing postures, that is an static morphology. So applying geometric morphometrics, we can analyze motion. And we based also our work in the body form standardization published by Waldock and colleagues that subtract all the information about body form, and we only consider the motion residuals. So the experimental setup was something like this, where we dissected 7 cadavers, where all the skull, atlas axis, and the C3 were kept intact, as well as the suboccipital muscles, ligaments, and fascia. It was something like that. And the skull was fixed in this setup, and 2 pins, the A and the B, were inserted in the third cervical. So moving the pin A with this fixed, we can provoke a flexion extension of the upper cervical spine. And moving the pin B, we could provoke a rotation of the upper cervical spine. On each of these motions, both flexion extension and rotation, we measured the spatial location of the bones with a 3D digitizer in 5 of these postures exhibited during this motion. So we have these postures, and we can we obtained the 3D models of the neutral position with a computed tomography. So we measured all the 5 postures on each of the motion on each of the 7 individuals, and we performed the Procurstes motion analysis and the body form standardization to obtain only the motion residuals. And we can perform a principal component analysis on these motion residuals. That here is the flexion extension. With this PCA, we explain more than the 95% of variation. And we can see here the total flexion, intermediate flexion, neutral position, intermediate extension, and total extension of all the individuals, that each of them draws like the motion, each motion trajectory of the individual. So if we we can try to predict if the neutral position relates to the motion trajectory. And we found a positive relation for the flexion extension, not for the rotation. But for flexion extension, knowing the cervical spine shape, we can predict the motion trajectory of this upper cervical spine. So we wanted to apply this to a Neandertal. Luckily, the Neandertal of La Ferracie preserved very well the occipital atlas and axis, so we wanted this case of study. First of all, we needed to obtain the neutral posture of La Ferracie to then predict the motion trajectory. So thanks to the fusion rotonto of RStudio, we could rotate and translate each of these bones to the neutral position of the modern humans to obtain the estimated neutral position of this Neanderthal. And then, using this function, predict PLS from data, we can predict, based on this neutral position, each of the postures exhibited through the flexion extension of La Ferracie. And we can compare it with the modern humans. But to see it better, we can use this function interpolate in MATLAB to add intermediate postures to these 5 postures to obtain this video, where unless the range of motion of Neanderthals and modern humans would be the same, we can see that here in modern humans, the motion between C0 and C1 and the motion between C1 and C2 is performed like in 2 different times, while in Laferraci it is performed on more together in these 2 joints. And this is what we can do applying Procrustes motion analysis. I think Marta later will also talk about all this methodology, and we want to add all the cervical vertebra to try to relate this also with breathing kinematics. So now I want to make a few remarks about the postcranial skeleton of Ruidera. And this is a brief work I have led, but I have been supported by all these colleagues. Luckily, we have more than 30 postcranial remains in Ruidera. As we have heard this morning, most of the fossil record is dominated by teeth and mandible and cranium, but we have here a few, like the 40% of the remains are postcranial elements. So we can perform a good research on this in the future. And we have started with a few elements that we presented last September in Paris. And they are the cervical, the hand, the scapula, ribs, and foot. The hand is the anatomical unit with the greatest fossils recovered so far, and it's, among other materials, the research focus of the PhD of Thomas that will be talked later. So I will only make a few statements of each of the bones of the hand. We see an scaphoid shape that is somehow rare and archaic. It resembles more Australopithecus sediba or Naledi, more derived morphologies. Regarding the metacarpal, we also see that it doesn't preserve the typical Neandertal morphology, and it's maybe closer to Homo antecessor. This is a classic measurement, and applying 3D geometric morphometrics, it's also a bit different from both Neanderthals and anatomically modern humans. In the proximal phalanges, we see that they are more or less similar to, for example, Café or Guevara, but we know, thanks to this resume that Miguel Lopez did about non-metric characters, we know that almost all these sapiens, Neanderthal and similar huesos has similar morphologies in the proximal phalanges. So it is not strange that Ruidera is similar to these species. But we are seeing maybe a gradient of archaicity, maybe from plus to minus from the carpals to the phalanges, but this could be a last chapter of the PhD of Thomas, where we would like to, in a future, analyze both integration and evolvability in the hand. So maybe in a future we can talk about this with more confidence. Regarding the foot, we have one proximal, one intermediate, and one distal phalange. We have started geometric morphometric analysis with the proximal one. We have concluded that this from the fifth finger, because the Procrustes distances are the smallest with this five finger in both modern humans and Neanderthals. And we see we could study the Sima and the Nisova individuals, and we see that Ruidera is a bit more archaic than, for example, the Nisova or Sima or Neanderthals. Regarding the cervical, this is so a small fragment that we could analyze the orientation of the upper articular facet in respect to the lamina, and we see that this angle is much closer to early Homo. Here we had the Nariocotomeboia and Homo antecessor, and is much closer to those than to modern humans or Neanderthals. We have also analyzed the scapula. This is an scheme of the axillary sulcus that in 80% of both Simael huesos and Neanderthals, it has a dorsal position, and we find here a ventral position. It's not that the 100% of the Neanderthals have a dorsal position, but most of them have. And we find the opposite morphology. And we also analyzed the glenoid shape, and again we find a closest morphology to earlier Homo, to earlier specimens than to more derived features like Neanderthals or modern humans. Lastly, the ribs have a degree of mineralization that resembles more with earlier specimens also, and the same for the shape. In this case, this is the first rib, and it's not the best image, but those individuals from Manisi, and this is Ruidera, so the closest individuals in terms of shape are from Manisi. So we are seeing here a different pattern of what we see in the teeth, for example, that we see some Neanderthal apomorphism, but here, apart from the proximal phalanges that are more derived in all, or at least in modern humans, Sima, and Neanderthals, all the postcranial remains we have analyzed so far are somehow archaic or not, do not present the typical Neanderthal morphology. So maybe we are here and in an example of the mosaic evolution that Antonio introduced this morning, because we are not seeing like a clear pattern of a path going to the Neanderthals in this postcranial skeleton. And that's all. Thank you very much.
Yeah, so questions? Wonderful. Too late. So let's go on with Tomás Torres Medina. Welcome.
Okay. Good evening to everyone, and thanks, Antonio, for giving me the opportunity to talk here. I'm Tomás Torres Medina. I work here at the Museum as a researcher for the Paleoanthropology group. My work here is focused on the study and research about the fossil collections that we have here, like El Sidrón and Simaña, but I also collaborate with other teams recovering new remains, like the new sites of Ruidera, where I study the hands, bones. Thanks to this, I have a unique access for very special fossil collections. And in these fossil collections, one of the most commonly recovered remains are the hand bones, as we can see here, presenting the hand bones from El Sidrón. Thanks to this, I decided to start a PhD thesis focused on the evolutionary change on the human hand during the Pleistocene in the context of the Iberian Peninsula. For example, here illustrated with a Neanderthal hand from El Sidron and an Homo sapiens for anatomical modern humans. This Iberian context for studying human hands is very interesting because we have records from early Pleistocene with Simadre elefante at 1.2 million years old and Grandolina with 900,000 years old. And in Middle Pleistocene with Simadre de los Huesos at 450,000 years old. That is a very peculiar place because there is the biggest bone accumulation in Europe. And in the southern plateau, we have Ridera at 350,000 years old. In the late Pleistocene, we can almost observe mostly Neandertal sites, remarking El Sidron by having the biggest Neandertal accumulation in Spain. But we also have hand bones in Valdegoba, Simaña, Cova Foradada, and Zafarraya. Here, I will start to describe more of the hand remains that we have recovered here in the Iberian Peninsula, starting with 89.2 from Simadre elefante, attributed to Homo affinis erectus. This is a fifth proximal phalanx, yeah, and its morphology presents, as Carlos said before, modern features due to the less curvature that is presented here. That is differentiating it from other archaic hominins. But as we can see here, in the diaphysis, we can observe these marked insertions that can inform us about the strength capacities that these early hominins could have. Then, in Grandolina, TD6, we can almost recover, they could almost recover an entire hand that allow us for study the hand attributed to Homo antecessor. As we can observe here in the wrist, we can observe how these bones start to project mediolaterally. This is the hamate, and this is the hamate process that works as a structure for the carpal tunnel. The carpal tunnel is a very important structure in the wrist because works as the bone structure for the insertion of the muscles and tendons that will serve the hand for other manual capacities. So we will observe how this carpal tunnel will be developed during the Middle Pleistocene. Focusing on the metacarpals, we can observe how this bone, that is the second metacarpal, starts to develop an enlarged distal region, while in the phalanxes, they have a modern morphology that is commonly present in the Middle Pleistocene. But we can observe too these marked muscular insertions. Then in the Middle Pleistocene, we can almost study the whole hand anatomy because they could recover every bone from the hand. That is a very interesting thing. This hand presents what we can say that derived morphologies in almost the entire hand, but not fully derived morphologies for being totally Neanderthal features. Starting by the wrist, we can observe how this hamate process is bigger than Homo antecessors and develops a really deep carpal tunnel. Then the metacarpals now presents what are called the lollipop shape. This means that the metacarpals present an enlarged distal region in contrast with thinner diaphysis in the shaft. Then the facets between the metacarpals and the wrist present flatter surface than in Sapiens because this is said that allows the hand to have a greater stability in comparison with other curved surface that allows for more mobility. The phalanx now present a wider morphology and they also present these marked muscular insertions. Here, what is remarked is the apical tooth shape that start to develop a mushroom shape that will appear in Neanderthals. In Ridera, that is also Middle Pleistocene, we can observe a mixed traits of morphologies. a mixed morphologies in the hand, starting by the wrist that, as Carlos said before, it presents a really archaic shape by this tubercle that is mediolaterally projected and reinforced by bone structure here, and the facet for the radius that is mediolaterally displaced in contrast with other Homo sapiens. The metacarpal, by its way, presents not a really archaic morphology, but now start to derive in most modern morphologies with this thin shaft and these enlarged distal regions. The phalanxes, as Carlos said, remain modern. These mixed morphologies, and according to the 3D morphometric geometrics analysis that we carry out, placed Ridera in a basal point of differentiation between sapiens and Neanderthals, not presenting fully Neanderthal characteristic nor fully Homo sapiens characteristic neither. So this allows us for this drive us for studying Neanderthal hands. Here, for Neanderthal hands, we applied classical measuring methods for study proportions in the bones of the metacarpals and in the thumb, that are the preliminary results of my PhD, and 3D geometric morphometric studies for studying only the shape of the metacarpals and the thumb. Describing in general the Neanderthal hand morphologies, we can observe how this process that I mentioned before is now really, really developed and is projected mediolaterally. The metacarpals, we can appreciate now this lollipop shape with big distal regions with really thin diaphyses. The phalanx now present a really wide morphology with shorter proximodistal dimension. And in the distal phalanx, we can appreciate this bigger apical tooth, giving, for example, in this is remarking, we can appreciate this mushroom shape in the distal phalanx. For example, this proportion in the distal region of the metacarpals, we can observe how the Neanderthals are differentiating from the sapiens by having wider than taller proportions in the distal region than in sapiens that have taller than wider proportions. Cima de los huesos, by its own, is placed between is placed more near the distribution of Homo sapiens. Talking about the flatness of the articular facets between metacarpals and carpals, we can observe how Neanderthals here are differentiating for sapiens by having a totally flat articular facet between this bone, that is the first metacarpal, and the trapezium. In the sapiens, we can observe how this curvature of the facet is more variable. Then we start by presenting the results of the 3D morphometric geometric studies in the metacarpals, studying every metacarpal by itself. Starting by the first metacarpal, we can observe how these, that are the Sidron sample and some Neanderthals, are differentiating in the first component from the sapiens. In this component, we can observe how the distal region of the first metacarpal is getting a wider morphology and an increased crest for the opponent's pollicis muscle. In the proximal region, we cannot observe such differences between the two species, but we can observe a small trend in Neanderthals by having more robust areas in this region. In the third metacarpal, we can observe that the pattern of distal region that are more robust is getting through. The distal region of the third metacarpals in Neanderthals and remarkably in Sidron are presenting more marked region for muscular insertions and and wider proportions in the distal region. But here in the third metacarpal, we can observe how these differences between sapiens and Neanderthal are placed in the articular facet, because as we see here, Neanderthals tend to present low projected styloid process in the third metacarpal in contrast with the really projected styloid process presented in the most of the Homo sapiens sample. In the fifth metacarpal, again, we can see how the distal region is differentiating Neanderthals from sapiens in most of the cases, with big developed crest for the opponent minimis and a bigger distal region. Then, in the proximal region, we can observe how Neanderthals differentiate from sapiens by having straightened up bones in the axial plane, because the sapiens present here a small torsion in the basal, representing how these articular facets in sapiens are much curved than in Neanderthals. For the second and the fourth metacarpal, curiously, there are not such differences. We can observe a small tendency a small trend in Neanderthals to have more robust morphologies, and even remarkably in Sidron sample. But this distribution is not really differentiating both of the species. This is very important. This is not very important, but this is have a sense, because first, third, and fifth metacarpal are the unique metacarpals that are affected by insertions, by the insertion for the muscles that are implied in the gripping movements here and the opposition movement here. So we can see how these muscular necessities in the Neanderthal hand have driven out this derived morphology in Neanderthals. These high muscular charges in the metacarpal can be observed too in the carpal tunnel that I mentioned before, because as we can see here in Neanderthals, this carpal tunnel is deeper and bigger, allowing for those muscular packages and tendons to go through the wrist until the metacarpals, while in sapiens, this carpal tunnel is smaller. According to the Neanderthal thumb size, we can observe how the thumb increased from the most archaic species to the most later ones, but this increase in the size don't take place equally between the two species. We can observe how, while in sapiens there is bigger proximal phalanx and shorter distant phalanx, in Neanderthals they present a smaller proximal phalanx and larger distal phalanx. Maybe meaning that there is a morphological trade-off in the thumb size, because the two structures end up summing the same value for the two species. About the morphological differences between Neanderthals and sapiens, we can observe how, again, the most wider and shorter morphologies are differentiating Neanderthals from sapiens. But here we can observe how cima de los huesos is taking place in the morphospace in between the two groups of species. This is only a single case because we don't have too much sample, but can illustrate how this population take place in between these morphologies. In the distal phalanx, we can observe how this derived morphology in Neanderthals present less variability within the sample, and how then the sapiens tend to present more variability and totally differentiating it from Neanderthals and sapiens. Cima, curiously, take place within the distribution of sapiens. Not saying that is a totally differentiated morphology that from Cima to Neanderthals, but we can observe how in this case, Cima de los huesos is outside the distribution of Homo sapiens. In this morphospace, we can observe how Neanderthals occupy the wider shapes in the proximal region, of course, and how this apical tooth is really differentiating in the second component analysis. What that means? So, as we can see, both of the bones present differentiations from sapiens by the muscular insertions and areas affected for the pad-to-pad grasping movements. And this differentiated apical tooth could be affected by the vascular necessities of the region, because as more developed is a muscle, more more nutrients or more nutritional needs it will have. This gives us some conclusions. That is a general evolutionary trend toward increased robusticity and load-bearing adaptation across. So we can observe a general evolutionary trend toward increased robusticity and load-bearing adaptation across the manual skeleton. This offers me a hypothesis that is morphological shifts are not uniform and follow a sequential cascade of specialization, starting in the wrist, then taking place in the metacarpals, and then ending in the thumb or the phalanges. And that in the late Pleistocene record may represent an evolutionary shift from the middle Pleistocene mosaic of archaic and derived traits observed in Ridera or Shimalos huesos toward the fully derived Neandertal morphotype that we can observe here, who is less variable. And thank you for your attention.
Good. So, questions?
Thank you, Thomas. Thanks for the talk. So, in the data that you were showing, in the human samples, if you were to have more samples, do you think that you would move towards the points where you had neandertals?
Sorry?
In some of the, for instance, these ones, yeah, the other one. In this one, you have a few modern human samples.
No,
so if you were to have more samples from different areas, like, places where you have cold weather and so on, do you think that you would move towards the area where you have only neandertals, or?
By having more human sample?
Yeah.
I don't think so, because this light blue sample is already a Neolithic Homo sapien sample that is very different from this morphology. So, in the case that this sapien sample that you mentioning has more grassis morphology or distinct morphology from other sapiens, will not really affect the distribution of Homo sapiens.
But I'm sure the weather modifies the hand shape, the hand that we have now in different modern humans, right? So it's not the same the hand that you need in south of Spain or the one that you need in Norway. So, do you have data from these rough places?
No.
Could it be that if you were to use this data, you would move towards the neandertals, or not really?
Okay, now I understand the question.
Yeah.
Maybe I don't know. I haven't read anything about northern populations' hands, but maybe.
So these ones are from Marbella or something like this.
These one are from Valladolid, and these one are from Nubian.
Okay.
From Sudan. So maybe if we use northern or cold adapted Homo sapiens populations, maybe they will present more robust morphology here, more near to Neanderthal morphology, maybe. But we don't have the data.
And just another question.
Yes.
So, do people study the feedback between the hand and the brain evolution? I'm sure that could be done.
Yeah, I'm sure that the brain evolution has changed the hand evolution, of course, by the use and the activity that we can do with the hand and we have to do with the hand. But this will be further studies to study the integration between brain and, in this case, hand morphology. I would like to do that, yes. I would like to study the integration between the hand and the rest of the body, to study how this cascade of morphological change affect these different areas of the human body.
Good. So if there's no more question, we move from hand to rib cage. We are doing a journey through all the body, and now it's time of rib cage.
Hello. Okay. So, hello, my name is Jose, and I'm going to explain to you my latest study, which is about Neanderthal rib cage growth and development using 3D geometric morphometrics. Well, so even though it's very, very low studied compared to other body parts like the crania or the femur, for example, the rib cage has an important role in shaping the hominin body plan, because its position within the axial skeleton makes the upper part to be very integrated with the upper limbs and the lower part to be very integrated with the pelvis. So beyond giving us information about the evolution of body form or the evolution of breathing kinematics, it also gives us information about the evolution of locomotion. The thing is that the rib cage has a lot of challenges to be studied, because first, if you are lucky, you will find some costovertebral material in the archaeological sites. And if you find it, you will see something like you are seeing now on screen, because ribs and vertebrae tend to be broken, commingled, fragmented, and lacking. It's very difficult to find like a rib cage in any hominin that you would like to study that has every single costovertebral material represented, at least. So even though we have this lack of well-preserved bones, the latest technologies allows us to make 3D rib cage reconstructions that are pretty accurate. So now we know the morphology of, the 3D morphology of rib cages from Homo erectus, Neandertals, and fossil Homo sapiens. So to sum up the differences between these species, so modern humans, which are on the right part of the screen, would be the derived pattern. And as you see, the ribs of modern humans are more inclined and more curved and torsioned. So our thorax tends to be slenderer, narrower, and shallower. Then the ancestral morphology would be the one shared by Homo erectus and Neanderthals, who have more horizontally oriented ribs. So the rib cage is relatively wider, deeper, and shorter. The thing is that we know like the adult or like developed morphology, but what about those morphologies that are present in infant or children in these individuals? So this study made by Openshaw and collaborators is very interesting, because they reported that in infant Homo sapiens, you can see, if I manage, yes. So we can see that ribs are very horizontally oriented in infants, and then because they have to use like the diaphragm for breathing in supine position, so then with growth and development, the rib cage tends to be slenderer in childs and then in adults for sure, and the ribs tend to be more inclined. So what about hominins? García Martínez and collaborators in 2020 performed a very novel study, and they studied early ontogeny in Neanderthals, which suggested that first, shape differences between Neanderthals and Homo sapiens are already present at birth. As you can see here in this plot, Neanderthals would be like the orange individuals and sapiens would be the blue ones. But in contrast, growth rates, like growth and development rates, are more or less parallel between individuals. So this would mean that for early stages of growth and development, even though Neanderthals have a primitive rib cage configuration, growth rates would be derived, but just in early ontogeny. So what about growth and development until adulthood? The thing is that there is a gap in the fossil record, because even though we have studied infancy and childhood and we know the adult Neanderthal morphology, we lack information about the juvenile and adolescent status. So we only have 2 juvenile specimens with enough costovertebral material to be studied. The first one would be Teshik-1, who had like 9 years old, and the problem is that this individual is inaccessible. So the second individual that we can study is Elsideron J1, which is this one. It has like 8 years old, more or less, and it's the central specimen for our study. Our hypothesis is that Neanderthals exhibit a derived pattern of growth and development that resembles that of Homo sapiens, which means that is slower compared to Homo erectus, for example. And our objectives are first reconstructing the rib cage of Elsideron J1 and then plotting ontogenetic trajectories of size and shape of the rib cage against age. So for this purpose, we first collected a control sample of 50 Homo sapiens individuals, CT scanned and requested to the New Mexico Descendant Image database with this selection criteria. But to sum up, there were just 5 developmental groups from childhood to adulthood and 10 individuals per group. All of them were males because all fossil individuals included in the study were males. So then the neanderthal sample is constituted by a child, then Elsideron J1, and 2 adults, Guevara 2 and Shanidar 3. And we also included the juvenile specimen of Naregotomeboi, Homo erectus, who has both an ancestral morphology and also an ancestral growth and development. So for accomplishing our first objective, we reconstructed and restored the costovertebral material of Elsideron J1. When ribs or vertebra were well preserved, we only performed mirroring, but in general the situation was that we had a lot of fragments. So we developed a vectorial estimation in which we first measured the form of the costovertebral material of a control Homo sapiens individual using these templates that you're seeing on screen of landmarks and semi-landmarks. And then we calculated the increment of coordinates between one metamer and the following one. So this would be like the vector of change. So here what we did was calculating in the control specimen the vector of change between this vertebra and the following one and applied it to estimate from this vertebra of the Neanderthal specimen the following. So then we estimated the full costovertebral series. Once we did it, we performed a 3D reconstruction of this restored material and we obtained this 3D reconstruction of Elsideron J1 rib cage. So then, once we performed this reconstruction, we measured all the sample using this template of 526 landmarks and semi-landmarks and performed a generalized percustes analysis for remove the effects of scale, rotation, and position between individuals. We described size and shape using the centroid size of all the sample, using the centroid size and a PCA in shape space, respectively. And then the main point of the study was to perform the ontogenetic trajectories. So what we did was plotting centroid size against age and shape scores obtained from the percustes shape coordinates against age. Well, so in our size analysis, what we see is that all Neanderthal individuals have the same rib cage size as their corresponding Homo sapiens developmental groups. It's curious that, it's not that curious, okay, that the Homo erectus individual, even though it's a juvenile, has an incredibly big rib cage that plots near the adolescent range of variation of Homo sapiens, which would be related to the lack of adolescence reported for this species that will be commented later. Okay, so the reasons why the rib cages of Neanderthals and Homo sapiens have more or less the same size could be related to some features. First, Homo sapiens have more thoracic kyphosis compared to Neanderthals. So the inner space of the Homo sapiens rib cage, even though it seems to be slenderer, could be the same compared to Neanderthals. And then also, Neanderthals have been reported to have more spinal invagination. So here you are seeing like a scheme of a transverse section of the thorax, and even though the Neanderthal one could seem to be bigger, larger, you see that the spine is more invaginated within the thorax, which would mean that in both cases the surface of the slice would be the same. Okay, then in our shape analysis, we see that in PC1 we can separate individuals according to species. So in the positive PC1 values, we have all Homo sapiens, which have like slenderer rib cages. And then in the negative part of PC1, we have all the fossils, having like a more pyramidal rib cage shape, and also like relative deeper, wider, and shorter rib cages. Then in PC2, we don't separate individuals according to species, but according to ontogenetic status. So in the positive part, we find the youngest individuals that have higher anteroposterior rib curvature, which is reduced with growth and development. And then the important part of the investigation will be like these plots. So here we plotted the centroid size of the rib cage against age to see the ontogenetic trajectory of Homo sapiens and whether fossils match it or not. So here, as you see, Neandertals that are in blue are following like the same trajectory that Homo sapiens have. Contrary, the Nariocotomeboi Homo erectus has like greater rib cage size compared to the Homo sapiens and Neanderthal counterparts. So first, talking about Neanderthals, it could mean that maybe Neanderthals and Homo sapiens shared the same adolescent growth spurt. However, given that there is a gap in the fossil record that lacks adolescent rib cages up to now, we cannot confirm this. And then talking about Homo erectus, here as you see in this tendency, even though the Nariocotomeboi has 8 years of dental age, his body size, his rib cage size, resembles that of a teenager of 15 years old or something. So here in this plot, we can see that Homo erectus lacked adolescence, and being a juvenile was already like with a somatic size of an adolescent. And then here, when we plotted the shape scores against age, what we see is that Neanderthals and Homo erectus have a different trajectory compared to Homo sapiens. They have lower Y values, which means that they have different shape, as we have seen in the PCA. And then, even though we cannot plot or estimate the trajectory because we have so low individuals and we will introduce like a Homo sapiens bias, what we can see is that these trajectories seem to be flatter, which makes sense regarding the investigations of Openshaw and collaborators, because as I have said in the introduction, Homo sapiens infants have very horizontally oriented ribs that with growth and development become more like inclined. Contrary, given that we know the Homo sapien, the configuration of infant Neanderthals and also of adult ones, we see that maybe this change in shape during growth and development is not that big compared to Homo sapiens. So here this plot would mean that even though Neanderthals could have had a derived growth pattern in size, their change of ribcage shape during ontogeny was ancestral, and I have summarized this here in this, would be like the conclusions of the experiment. So here, when we talk about ribcage growth in size, we see that Homo sapiens has like this trajectory that would be shared by Neanderthals, that could have maybe increased adolescent growth spurt, but that would be more associated to Homo sapiens than to Homo erectus, where growth would be faster and would have lacked adolescence. Contrary, if we talk about ribcage development during like ontogeny, we would see that Neanderthals and Homo erectus share a flatter trajectory, which would be ancestral, while Homo sapiens has like more magnitude of change from infant to adult configurations. So here what we see is that Neanderthal growth and development is a mosaic, according to our results, and growth would be derived, but development would be ancestral. And that's all. Thank you very much.
Okay, Juan, do you have any question? Okay.
Well, thanks for the talk. So, is it possible actually to model ontogenic trajectories in modern humans?
I repeat again, sorry.
Is it possible to model the ontogenic trajectory with the human data?
It's possible. I did it, but the problem is that, wait.
with some sort of, I guess.
Yes, so the problem is that I tried to model this trajectory using this data, but I realized that it was basically the same trajectory but just shifted down, because we have so poor fossil sample, so the estimation is very biased by the Homo sapiens sample, because we have 50 individuals against 4.
So you use the information of the modern humans to
Yes.
simulate the trajectory of the Neandertals?
I
Is that what
tried,
you're saying?
but I realized that it was just the same trajectory, but just shifted.
And this model is based on what? On some sort of speed of change or something
No,
like that?
this model is original. It's just a plot against the shape coordinates against age. So that's it's a lowest regression.
It's a what?
Lowest regression.
Yeah, but if you were to model somehow the speed of change or something like that, like vectors in that space, then you will have directions. And if you start from the initial points where you have data in the Neandertals, you might simulate these directions and maybe reaching some endpoints and just checking whether by modifying these sort of speeds, you would actually simulate the Neanderthal trajectory.
Good option. I will try. But I mean, as far as I have been investigating in this topic, the problem with fossils is that if you have so low sample, it's very difficult to create trajectories that have.
No, but I want to use the modern humans trajectories. So if I characterize in this sort of phase space the trajectories of change, then I know that from the initial point, I'm going to follow this trajectory, and in this one, just based on current humans. And then I use these arrows, this information, to model the trajectory from the initial states of the Neandertals, and just go to the end.
Yes,
and check whether I reach the same ending point where I have data. If I don't, then I modify slightly the arrows, the speeds.
Would you say something similar to what we have done to restore the costo-vectorial material? Because we calculated the vector of change of sapiens, which is not something it's just a vector of change, and we applied it to the extant Neanderthal material. So it's more or less the same,
okay, yes.
but applied to that. A good idea.
Yeah.
Okay, I take notes. Thank you very much.
Thank you, Jose. Sorry, I got lost. Could you repeat briefly why do you think the Nariokotomi boy has not adolescent spur?
Because, well, here, I mean, I have read that the dental age of Nariokotomi boy is dissociated from his somatic age. Yeah. And the opposite happens with Neanderthals, which I didn't know. Neanderthals have also some dissociation like that, but their dental age is they are older dentally and younger postcranially. I read it the other day.
Not in our study. Not exactly. No, we found that the dental development matched the somatic development.
Yes, but
it's not quicker than it was proposed by other researchers, according to our results. So there is not that imbalance comparing with Homo sapiens, which is clearly shown by Holly Smith and Christine, that in the Nariokotomi boy there is the coordination between dental and somatic development.
Yeah, but what was very curious was that I thought that this decoordination would be like a straight line until sapiens or until the derived pattern. And when I read that, they say that the decoordination in Neanderthals is the opposite as the one in the Nariokotomi boy. I said okay, super interesting. But regarding the Nariokotomi boy, so I say that they didn't have adolescence because they had 8 years old. The Nariokotomi had 8 years old, but a body of an adolescent. So it's like they skipped the process of being an adolescent, which in sapiens would be from, 10 years old to 19. Yeah. And they already have an adolescent body having 8 years old. So that's why I say that they skipped adolescence.
Okay, thank you very much.
Okay, so thank you. From in the same region from form to function, the last talk is the one by Marta. Welcome.
Hello, do you hear me correctly? Okay, so I will bring today a slightly different topic and try to explore the relationships between shape and function from the point of view of the evolution of the respiratory system in Homo genus. I know you must be a bit tired. I'm the last speaker of the session, so I will try to keep it as simple as possible. So starting easy, fossils. We paleoanthropologists love to work with fossils, and we can call them the bricks with which we construct evolutionary theory. We can dig a fossil, describe them, compare them, discuss them in their context. This is more typical of classical paleoanthropology. We can also measure them with traditional or more modern methods. We can reconstruct them, estimate their missing parts, and finally, in the last step, we can try to, or attempt to infer some things from this new knowledge a fossil brings us. It can be ecological, developmental, evolutionary, or functional. In my PhD, I'm trying to answer this following question. Is breathing motion related to torso shape in humans? It is a big question, so I tried to divide it into some smaller questions. So the first one would be, how can biological function be inferred from fossil evidence? Followed by, how do torso morphology and breathing kinematics vary? Then, how is torso morphology linked to respiratory function? And finally, what can respiratory function reveal about hominin paleoecology? So starting with the first one, inferring function from morphology. It's a complex issue for us paleobiologists. We can see form-to-function relationships at different scales in biology, from the shape of an enzyme and the allosteric site to the function it performs, to different cell types and their morphology related to their function. We can continue to increase the scale and see how we can find different convergent structures, like in the shape of a wing, related to the function of flight, or even relate shape to ecology, in the case of the shape of the beak and the diet, in the case of finches, for example. So I tried to make a summary with all of this, with this sentence, that shape can help us infer function when we look at the extant world. So if we tried to model shape as if it was a normal quantitative variable, we could use a normal distribution, for example. No matter the real kind of distribution or variable it's taken, we could argue that there is a shared variability between different groups for a defined morphological trait. For example, the length of the femur. Here I chose an example from the literature. They are measuring the length of the femur in two different populations, Caucasian and Asian. And we can see there's a strong overlap between those. Even though they have different means or distributions, we see some shared variability. So we can try to expand this rationale not only to different populations, but also to our closest relatives, in this case, the genus Homo. So we could try to plot it like this to understand it. So this will be the big assumption we will make throughout this work. And well, let's start with this fossil. This is the thorax of the Nariokotome boy. Jose has already spoken about him. It is a Morgaster juvenile male found in 1984 by Kamoya Kimeo in Kenya. And it's dated in 1.5 million years. It presents a deep and wide thorax, which is considered to be the primitive condition for this species, or for the genus Homo, in fact. This was reconstructed in 2020 by Bastir and colleagues through geometric morphometrics methods. And this is the principal figure of the paper. It is a PCA exploring how shape varies from juvenile Homo sapiens and adult Homo sapiens, and plots also here the different fossils. So here we can see the allometric vector of growth in Homo sapiens, and we can turn it and project it to a normal distribution so that we can score the different means into the distribution. If we did that, this is a graphical approximation. We could see how Homo sapiens adults score to the left, while Homo sapiens juveniles score to the right. And if we keep on projecting the fossils, we can see that they are scoring all to the left part of the distribution. So we could be talking about something similar to this. So now we want to measure how shape and function, in this case torso morphology and breathing kinematics, vary separately. To do so, we did a motion capture experiment. I will not delve into the details of the methodology because it's quite complex to explain, but basically we just recorded breathing motion after exercise in 17 young males, and we also measured the shape of the torso of these individuals through 3D geometric morphometrics. To quantify motion, we did an analysis of motion residuals extracted from these coordinates through time, and so that we can characterize motion regardless of the shape of each of the individuals. To do so, we did a singular value decomposition of like a PCA of both blocks, shape and motion, separately, and we obtained this. These are the plots, and these are what they explain. So the first principal component of shape was separating flatter morphotypes from deeper morphotypes, and it was explaining like 37% of the overall shape variation. And in motion, we have a component here explaining 74%, which is a quite reduced dimensional model of motion. And between the two first components, almost all the motion is explained. And they were explaining in the PC1 the torso extension, in which we can see an integrated motion of the thoracic and the abdominal compartment. And in PC2, we have another component, secondary, but also important, which is characterizing abdominal motion. Okay, so now that we know how shape and motion vary individually or separately in the sample, we want to know how they covary together. To do so, we use this tool called two-block partial least square analysis, which is a method of analysis of covariation. So what we find in this analysis is that the first latent variable is showing a strong correlation between shape of the torso and motion of the torso, quantified as the trajectory shape. So like what we saw in the first, here in the principal component of motion, we relate each of these trajectories to the shape of each of the individuals. And here, what we observe, explaining more than 90% of the variance of motion, we observe that deeper morphotypes are related to an integrated motion of the torso, in which we can observe an increased torso extension, while the flatter torsos are related to I don't know if you see it now with the motion here. We can see that there is a slight delay of the thoracic compartment in relation to the abdominal one. So we are observing some kind of modular, temporal modularity in the function of the breathing motion. So finally, taking all of this into account, what can respiratory function reveal about hominin paleoecology? Okay, if we took our Homo erectus reconstruction, we could argue that it's similar to a deeper morphotype. So it should breathe similarly to those deeper morphotypes based on this Homo sapiens model, of course. We could place it here in our normal distribution. And when we predicted through the PLS model of Homo sapiens, what we obtain is this kind of motion, which is quite similar to the one of the deeper torsos. As you see, it's dominated by an integrated motion of both compartments into a torso extension. This led to the preliminary hypothesis of breathing pattern evolution, because this is based on a quite small sample, in which we proposed that deeper morphotypes and plesiomorphic torsos, like this one characterizing Nariokotome boy, are functionally integrated in terms of breathing after exercise, at least, and we observe a synchronous movement of both compartments, while in the flatter morphotypes, which are derived and are thought to be appeared in Homo sapiens, we can observe how these two compartments decouple and move asynchronously after the exercise. Physiology literature is relating thoraco-abdominal asynchrony both to diseases or respiratory disorders such as COPD, but also it is observed in healthy subjects, such as after spirometry, during diaphragmatic breathing exercises, and also after exercise and with exercise intensity. So we're observing the same pattern of thoraco-abdominal asynchrony in both pathological and healthy individuals. So here also we're observing different reactions of breathing pattern after intense exercise. We have an integrated reaction to exercise and a modular reaction. Some studies are linking diaphragmatic breathing to at rest and also during exercise to better energetic performance and also to this thoraco-abdominal asynchrony. So these results could be bringing up a long-standing debate of the role of persistence hunting in Homo evolution, which requires the ability to perform endurance running and sustain exercise during time. Diaphragmatic breathing would not only increase the performance of endurance running because it's related to a lower energetic demands, but also results are linking this type of breathing to a morphotype that is supposed to appear only with Homo sapiens or anatomically modern humans. So maybe they could increase this performance of persistence hunting. Anyway, to better understand all of this, we must, of course, increase the sample size, include diverse populations, amplify the sample, and of course measure the energetic performance, if it's possible, only in one study, which usually is complicated. So, well, that's it, and if you have any questions.
Well, it's likely that Juan has some questions, so, oh, yeah.
So, did you expect dorsal morphology to be so low-dimensional in advance? So
To be so?
Low-dimensional, because you mentioned that somehow you use only the first two components, principal components.
Yeah, dorsal morphology is higher in its dimensionality, but no, I didn't expect motion to be so easily characterized through such smaller dimensions. Also, it's residual information with what we are measuring here, but the first principal component was explaining, like, I think it makes sense also after exercise that we are recruiting all of the muscles possible. Maybe if we were exploring different intensities, which we have also measured but didn't analyze yet, maybe their motion is more variable. But I think after exercise, when the body demands are so intense, maybe this is the easiest way.
So you have some sort of coordination of all the muscles, or something like that?
Yes, I would say that like the whole system is involved in obtaining meeting the oxygen demands.
Thank you.
Yes.
More questions?
How did you select the sample?
The sample was selected as a preliminary study at the University of Brussels. And they were, they had some inclusion criteria like non-smokers. Most of them were they were students, male students, all of them. Also, the fossil in question was male, so this made sense. And they were just volunteers.
Thank you.
Thank you, Marta. Very nice talk and very interesting. I would like to ask you about the future steps you mentioned for just as a curiosity for dealing with ontogeny, to try to delve into different ontogenetic patterns or how the breathing kinematics develop with ontogeny. So how would you deal with that? Because adults are volunteering, but subadults need the approval of their parents. So I don't know if you already dealt with that or if you're thinking about that for the future, because I don't know if because we know that the thorax ontogeny makes like important changes, during all the life. So I'm thinking if also the breeding kinematic pattern changes in different ontogenetic stages, and if you would deal with that, with parental permission and stuff. Thank you.
Of course, always with the parents' permission. But I would love to be able to study how this works through ontogeny. For now, I don't have the sample to do so, but also maybe with collaborations with some other researchers. Now we're working with different teams, and we are trying to expand our networks on this topic because it's an area which is quite new, where usually we don't study motion in breathing, but volumetric changes, which are similar but are not expressing the direction of change. It's just the overall change in volume or size of the chest wall. So because this is really new, all of the studies that have been done in infants or because they have been done in physiology literature, but they all have been done with volumetric changes. So now we would like to use this data, which is already captured and has passed the ethical committee and everything, to do the motion analysis.
Changes in different stages?
Yes.
Change between around 2 years, something like that, in thorax shape. Because it said that babies, newborns are like more
diaphragmatic. Yes.
But it's like basically theory. So I think nobody have actually put all the. Thank you. I think nobody, because of ethical and obvious reasons, nobody have quantified the breathing kinematics in a baby. But at some point it will be actually interesting.
I think there's some studies quantifying kinematics.
Like creepy studies or like, okay. Because I think I don't know, that would be interesting to test if this hypothesis of the more diaphragmatic breathing in newborns or kids are actually like that, or like a full quantification as you did in this sample. Would be super nice to do it in.
Yes, I would really like to. I know that babies, for example, have a chest wall that is more compliant, so that it can change more, in contrast to adults, we are less variables in these terms. But yeah, it will be really nice to explore all of this, and it's just a matter of time, I hope.
Thank you.
Okay. So I would pass the micro to Antonio for the closure.
So before we finish, Bernard asked me to say something. I don't know what he's going to say, but he wants to say something.
Okay. Well, what I want to do, it's the end of a very long day, and so I want to offer some thanks, I want to offer some apologies, and I want to offer some congratulations, and I want to spend more time on the congratulations. I want to thank Antonio for I'm not sure he did invite me. I think I invited myself, and he very kindly organized this day. I want to thank the AV people for working hard all day, and the museum for their hospitality. I want to apologize to the young people because the day involves some more senior people with gray hair, but Antonio sort of recruited the younger people. I'm sure, you should give a paper, why don't you do that? So I'm sorry so I just want to apologize to the young people who were sort of dragged into this to give the papers. But I also want to congratulate the young people. The science of paleoanthropology is in really good hands. And the young people I'm referring to are the ones who got their PhD maybe within the last decade, and the ones who may not have their PhD yet. So those are the people I'm talking to. You did a really good job. And I would go through each of you, but it would mean that there would be more time between you and alcohol, and so I won't do that. But I just want to say that I was a clinician before before I got interested in paleoanthropology, and I worked at a specialist hospital for diseases of the spine, and that was essentially sort of people that had lesions of the vertebral column and the spinal cord. And it's amazing, you could see people who had no function below C3, and they were sitting in a bed and they were breathing, and they could breathe well enough to, to do normal function, but they had very thick necks. And they were just largely breathing with their scalene muscles. So I want to congratulate Carlos, was it, who did those excellent dissections, and to assure you that it's really important. And so what was really impressive with the young people was to put the biology into paleobiology, the emphasis on respiration, on physiology. I mean, we have to try and inject life into these extinct hominins, and you are doing that, and you will do that, I'm sure, very effectively. The other thing as a junior surgeon that you did a lot of was carpal tunnel surgery, because it's pretty simple. Okay, you just slice through the ligament, and you release the pressure in the carpal tunnel, and you decompress the median nerve. And so my question is, would Neanderthals have needed carpal tunnel surgery? So I will leave you with that thought, and I just want to thank everybody who participated today, and especially Antonio, who I've known a long time, for arranging this and for making the visit possible, and for making today possible. So many congratulations to everybody, but especially to the people who should have been speaking this afternoon. One of you was moved up to the morning. And so many, many congratulations.
So, we come to an end. I'm going to speak in Spanish.
Yes, and thank you for speaking English.
Bueno, muchas gracias a todos. Espero que lo hayamos pasado bien, aunque un poco cansados. Ha sido un día largo, yo creo que muy fecundo. Hemos visto qué hacemos cada uno de nosotros y, bueno, pues hasta la próxima, en el próximo coloquio sobre paleoantropología. Gracias a todos y hasta la próxima. Let's, Emiliano say to make a picture of us, for the speakers. He's excluding the visitors, I mean the people in the room. Let's go to the speakers to make a picture together.